Laser Therapies Beyond SLT, July 2026 Protocol Innovations. Selective Laser Trabeculoplasty (T) is a well-known laser treatment that lowers eye pressure by targeting the eye's drainage tissue, trabecular meshwork. Recent studies, July 2026, have explored new laser approaches and tweaks to SLT for glaucoma and ocular hypertension. These include modified SLT methods, like non-contact SLT and pulsed lasers, Micropulse laser techniques, and canal-focused procedures using either lasers or tiny implants. We summarize the latest dosing, energy, retreatment rates, pressure drop results, and safety findings, and explain what they mean for patients. Modified SLT approaches, direct SLT and Micropulse LT. Researchers continue to refine SLT itself. For example, a new direct SLT system treats the drainage tissue without touching the eye. In a large series of 218 eyes, Goldberg et al. 2026 found that 67.0% of eyes reached their target pressure at 2 months after direct SLT 26. The average eye pressure fell about 3.4 mmHg, a 15.6% drop from a baseline of 19.7 mmHg. Importantly, eyes that had never used pressure drops before did even better. About 78.4% of these treatment-naïve eyes hit the pressure goal, versus 63.5% of eyes already on medication, Goldberg2026. Side effects were mild. Over half of eyes had a small subconjunctival bleed, a tiny bruise on the eye surface, and only 1.8% had a brief pressure spike. No serious complications were seen. Another line of work uses a pulsed laser for the same 360-degree treatment area of SLT. This Micropulse, SLT applies many tiny bursts of laser energy to gently stimulate the drainage meshwork. In a head-to-head trial, Abramowitz et al. 2018 found that 1 year after treatment, Micropulse SLT and standard SLT gave very similar pressure drops. About 30 to 37% of eyes in each group had a 3 mmHg drop or 20% reduction in pressure. Abramowitz 2018. The big difference was comfort. Patients reported significantly less pain during and after the Micropulse laser, p equals 0.005, Abramowitz 2018. In short, modified SLT methods, whether non-contact or pulsed, appear as effective as standard SLT in lowering pressure, with the advantage of easier delivery and less discomfort, Goldberg-26. New Micropulse laser treatments. Beyond SLT-style procedures, Micropulse lasers have been applied in other ways. One major application is ciliary body cyclophotocoagulation, where laser energy is delivered through the sclera, the white of the eye, to reduce fluid production. In a recent retrospective study of 118 eyes with various refractory glaucomas, Top 10 et al. 2026 reported dramatic pressure reductions from Micropulse transscleral laser. After one treatment session, mean intraocular pressure, IOP, fell by about 46 to 56% across glaucoma types. For example, 46.5% in primary open-angle glaucoma, 50.4% in neovascular glaucoma, up to 56.2% in juvenile glaucoma. Top 10 2026. Overall, the group-wide drop was 48.8%. Initially, 66.9% of eyes succeeded, reached target IOP after one session, and after allowing repeat treatments, about 75.4% met the goal by 12 months. In practice, most patients, 67%, needed just one session, while 28% required 2 and 5% 3 sessions up to 1 year. Top 10 2026. Notably, this powerful pressure lowering came with very few serious side effects. No eye developed dangerous chronic low pressure, hypotony, or shrunken eye, phthisis, complications seen with older cyclodestructive lasers. A few mild issues were reported: temporary eye inflammation in 3 patients, small bleeding in 1, and 1 patient had a transient pupil dilation. Top 10 2026. In summary, Micropulse transscleral therapy can cut IOP roughly in half with a 1 to 2 session protocol, at the cost of mostly minor and temporary effects. The dosing used in these studies was high power but pulsed, typically a 2,000 milliwatt laser with a 31% duty cycle, short on bursts totaling about 160 seconds of delivery around the eye. Top 10 226. This delivered about 70 to 80 joules of energy per session. The key is that micropulsing lets the tissue cool between bursts, minimizing collateral damage. Canal-based procedures, excimer trabeculostomy and canaloplasty. Researchers are also targeting the eye's fluid canal, Schlemm's canal, with new techniques. Excimer laser trabeculostomy, ELT, is one such method. A tiny ultraviolet laser makes microscopic holes through the trabecular meshwork into Schlemm's canal. In a small pilot study, Collab et al. 2026, patients undergoing cataract surgery plus ELT showed measurable improvement in aqueous outflow. Dye angiography before and after the procedure found a significant increase in fluid flow, p equal 0.03, across the treated drainage area, Collab 2026. This suggests ELT can enhance the natural channels, although large-scale pressure data are still pending. Separately, non-laser canal procedures, sometimes grouped here, are showing large pressure drops. For instance, an canal-focused trabeculotomy, a microcatheter device that dilates Schlemm's canal and cuts through trabecular meshwork, was studied in 18 patients, Olander et al., 2026. Baseline mean IOP was 26.1 mmHg. After 12 to 24 months, IOP had dropped to about 15.5 mmHg, a 9.7 to 0.6 mmHg reduction, Olander 26, and most patients reduced or stopped their drops. In fact, 67% of patients were off glaucoma medications by 24 months, Olander 2026. Adverse events were mostly mild. No eye lost vision or suffered major complications, and only one case of dry eye was thought related to the procedure, Olander 26. This demonstrates that opening the canal can yield a 40% pressure reduction, comparable to traditional glaucoma surgery, but with a very favorable safety profile. Patient factors in choosing a protocol. Eye color pigmentation. SLT and micropulse lasers target pigmented cells in the drainage tissue. Evidence suggests micropulse methods work well even in darkly pigmented eyes. Animal data show these pulses trigger enzymes that remodel the trabecular meshwork without excessive heat, Abramowitz 2018. In practice, no major differences in efficacy by eye color have been reported. All these laser options are intended for open-angle glaucoma. They are ineffective in eyes with closed or very narrow angles. Angle status. All the laser treatments above require at least a partially open drainage angle. If your angle is closed, the first step is typically a laser peripheral iridotomy or a cataract operation to open the angle. The canal-based surgeries are usually done in open-angle eyes too, often at the time of cataract surgery. Prior therapy. Timing matters. The direct SLT study found bigger pressure drops in eyes that had never used drops before, Goldberg2026. For example, medication-naive eyes had a 20.2% IOP reduction after 2 months of DSLT versus 14.2% in eyes already on drops, Goldberg's. This suggests earlier use of laser before maximal medications may give a better percentage drop. In general, laser trabeculoplasty, any type, can be repeated if needed. In the Micropulse Cyclo series, about 1/3 of eyes needed a second session to reach target, yielding 75% success by 1 year, Top 10 2026. Expected results. Based on these studies, patients can expect a moderate IOP drop on average. SLT or micropulse trabeculoplasty, 360 degrees treatment, typically reduces pressure by 15 to 25%, helping 30 to 67% of eyes reach their goal with one treatment, Goldberg 2026, Abramowitz 2018. Micropulse cyclodestruction often gives 40 to 50% drops and usually requires scheduling 1 to 2 sessions, Top 10 2026. Canal procedures like Omni can cut IOP by 40% as well, Olander 2026. However, individual response varies widely. If you have high baseline pressure or aggressive glaucoma, a bigger intervention, multiple sessions, cyclo, or combined surgery may be needed versus a mild case where single-session SLT suffices. Safety profile. All these lasers are generally safe when used correctly. In the new studies, serious complications were rare. SLT, even direct SLT, mainly causes brief redness or tiny bleeds, and pressure spikes were under 2%, Goldberg 2026. Micropulse lasers spare tissue and caused minimal inflammation. In one report, almost no eyes had permanent loss of vision or severe hypotony, Top 10 2026. Canal surgeries like Omni had a few mild events, dry eye, transient inflammation, but no vision loss. Overall, these methods are much less invasive than traditional surgery trabeculectomy and typically do not carry high risks of blindness or severe complications. Conclusion. July 2026 studies show that innovations in glaucoma lasers are yielding more options beyond standard SLT. Modified SLT techniques, non-contact devices, or micropulse pulses match SLT's pressure lowering with the promise of quicker treatment and less discomfort. Goldberg2026 Micropulse cyclophotocoagulation is proving to be a powerful tool for hard-to-control glaucoma, cutting pressure by nearly half in many eyes with minimal side effects. Top 10 26. And canal-targeted procedures, both laser and microsurgical, are delivering large IOP drops, 10 mmHg on average, while reducing the need for medications. Olander 2026. In practice, the choice of protocol will depend on your specific situation. For newly diagnosed open-angle glaucoma on no drops, a laser trabeculoplasty, SLT or micropulse, is a reasonable first step. If you have higher pressures or more advanced disease, micropulse cyclo methods or combining lasers with surgery may be considered. Eye color, angle anatomy, and prior treatments all play a role, but the newest evidence suggests that these laser options work across different patient groups. Discuss with your ophthalmologist. Together, you can weigh the likely IOP reduction and side effects in your case. With these advances, patients now have more laser choices than ever to safely manage glaucoma. Sources: recent glaucoma laser studies, Goldberg 2026, Abramowitz 2018, Top 10 2026, Kalab 2026, Olander 2026. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.